Hello students, and welcome to Essentials of Healthcare Management. This is week 1, and this week focuses on evolution and organization of healthcare services. My name is Jamie Markshausen, and I will be your instructor for this quarter. I have listed my contact information. Feel free to contact me anytime with questions, comments, or concerns. You can contact me via email, Blackbird IM, or feel free to call or text me. As you can see, my office hours are listed, but just know that I am also available outside of those office hours as well. You can also find my contact information under the instructor page within the classroom. So the historical evolution of health services in the United States. And each country's health services system is a result of the country's social, political, and economic history. It is also a reflection of the country's values, culture, and shared beliefs about itself. The American healthcare system has evolved with regard to 4 important issues over 4 consecutive time periods. The major health problems upon which the existing system focused at the time, the targets, the resources that were available to the system to bring to bear on those targets, the vehicles of social organization that could bring the resources to bear on the disease targets, and the involvement of people in the healthcare system as it was evolving toward its present shape and form. Next, we're going to kind of talk about a little bit about the development of healthcare. First, we're going to talk about predominant targets of the health system. In 1850 and 1900, this was epidemics of acute infections. Some of these epidemics related to food, water, housing, and conditions of life. In 1900 to World War II, these were your acute events, and this was your trauma or infections affecting individuals, not groups. In World War II in 1980, this focused on chronic diseases such as heart disease, cancer, and stroke. In 1980 to the present time, chronic diseases, particularly emotional and behavioral related conditions, as well as conditions related to workplace, environment, genetic inheritance, and terror threats. Next, when we look at technology, technology looks at how to handle predominant health problems. And in 1850 to 1900, there was virtually no technology taking place at this time. When we look at 1900 to about World War II, these were the beginning stages of technology, and there was rapid growth of basic medical sciences and technology. In World War II to 1980, there was explosive growth in medical science. Technology captures the healthcare systems in this era. And in 1980 to present time, continued explosive growth and expansion of technology with parallel rise in costs of healthcare. As we continue to talk about the development of healthcare, we look at social organization for healthcare. And in the period of 1850 to 1900, there was literally no social organization. Individuals were left on their own to find resources or clarity of infections or diseases. In 1900 to World War II, this was the beginning of societal and governmental efforts to care for those who could not care for themselves. In World War II to 1980, this was the development of health insurance as the primary vehicle of social organization of healthcare in the United States. And in 1980 to present, this is where there was increasing power of financial organizations to shape the healthcare system. Increasing influence of governmental financial systems. Examples of these included Medicare and Medicaid. Finally, when we look at the development of healthcare, we look at the involvement of people in their healthcare. And in 1850 to 1900, people were actively involved in giving care to family, and there was little factual knowledge about infections and diseases and medical practices. In 1900 to World War II, beginning availability of medical knowledge to the general public was being presented. In World War II to 1980, there was more awareness at this time. Healthcare was seen as a social and political issue by the public. By 1980 to present, people were well informed, but increasing frustration with the complexity and expense of the system was the major problem during this era. Next, I want to talk about some of the basic service components of the healthcare system. And as you can see, the healthcare system is made up of a lot of different areas that keep the system put together and to work collaboratively amongst one another. First, the system is made up of health promotion and disease prevention services. Next, it is made up of emergency medical services, and this includes your transportation such as ambulances. Next, ambulatory care. This is for simple and limited conditions. You also have ambulatory care for complex and continuing conditions. You have inpatient care for single and limited inpatient conditions, as well as for complex and multiple inpatient conditions. You also have long-term care, and long-term care can be either in the home or institutional services. Further, you also have services for social, psychological conditions, and these are found for both inpatient and ambulatory care services. You also have rehabilitation services, and rehabilitation falls within both inpatient as well as ambulatory. You also have dental services and pharmaceutical services. So I just kind of gave you an overview of some areas covered in Chapter 1 on the historical evolution of healthcare services. So it is your responsibility to read the entire Chapter 1 and also to review the additional learning resources. For the discussion thread this week, you're going to explain how healthcare is organized within your local community. You're going to explain the domination of healthcare services, the larger or smaller entities. You're also going to explain the role of the state government regulation in defining healthcare. And now I just kind of want to highlight on some minimum expectations for the course. So please know that for the discussion thread, you should have at least at minimum of 150 words to receive full credit. You need to respond to 2 other classmates' postings. Please make sure that you are posting on time and that when you are responding to 2 other classmates' postings and posting your discussion thread, that they are not both within the same day. You need to participate in the classroom at least 2 days a week. And then for your journal questions this week, I do expect that at minimum of 3 sentences, and this will help to explain the concepts in each question, and it will show me that you understand the material that is being presented for this week. So like I said, if you have any questions, comments, or concerns, please feel free to contact me via email, Blackboard IM, or you can call or text me. I'm here to help you, and I would like to help you be successful this quarter. So let's have a great quarter, and I look forward to working with each of you this week.